All right, hi everybody. I'd like to welcome you all to our webinar this month. That we're going to be talking about some myths and facts about trichotillomania or hair pulling disorder. My name is Maya Schonbach, and I am a clinical psychologist, and I work here at Trichstock. And today we're going to be doing a more interactive webinar, actually. So it's good that you're here live because you'll get to join in on all the polls. And it'll probably take around 40 minutes, this webinar, and then we'll have time at the end for Q&A in the chat. So I really recommend that you guys write in your questions. Anytime you have anything pop up into your head, write it into the chat, and we'll go over them all together once the presentation is over. And then also, I really encourage you guys to stick around until the end because I'll be giving a promo code for a discount on subscribing to Trichstock at the end of the presentation. So let's get started. So first, what are we going to talk about today? So first, 10 common myths and facts about hair pulling disorder. We'll talk about why there are so many myths about hair pulling. And then I'll give you some tips on how you can debunk mental health myths online yourself. And then we'll conclude and we'll do a Q&A. Let's get started. So let's start with a poll. Myth or fact? Hair pulling disorder is just a bad habit or phase that people grow out of. What do you guys think? Anybody else? Yeah? Some answers trickling in. Okay, let's see what everybody said. Okay, great. You guys were all in consensus that it's a myth. 100% of you said that. And let's see. So you're right. It is a myth because hair pulling disorder is a classified mental health condition. Really, it's characterized by repetitive and compulsive hair pulling. And that hair pulling leads to a significant distress and functional impairment. So this is all written in the Diagnostic Statistical Manual, the DSM-5, that we use to diagnose mental health professionals use to diagnose mental health conditions. And it has been found that some people may experience a decrease in symptoms over time. However, for many people, it does persist if they don't get appropriate intervention or treatment. So really, it's not just a phase that people naturally outgrow, but really it's a complex issue that typically requires professional support for management and for recovery. So yeah, you guys are all right. Okay, let's go to the next one. So what do you guys think? Myth or fact? Trichotillomania or hair pulling disorder is a rare condition. Anybody else? Okay, interesting. Let's see. So 75% of you thought it's a myth and 25% thought it's a fact. So we're more split in this one. So let's see. So it's a myth. The majority of you were right. So the prevalence of it ranges between 0.5 to 2%. So that's pretty high proportion. You actually think of 2% of the population. It's a huge amount of people. But unfortunately, there's still such a huge amount of stigma that surrounds, first of all, mental health conditions in general, but also specifically hair pulling disorder. And there's a core element of hair pulling disorder that commonly includes a feeling of shame around the behavior of the pulling. So that shame really typically prevents people from talking about it or from seeking help. So first of all, I want to say that staying informed and learning about the disorder by doing things like you're doing now, like joining webinars, it's a really great first step. And also here at TrickStop, we have a lot of different resources that can help with building a sense of community. And that they really help normalize and reduce a sense of shame and hair pulling. So if you want to hear more about that, let me know right into the Q&A, right into the chat. But we have online blogs, forums. If you sign up for our programming, we also have support groups online, social media that are really a great way for a source of information, but also to feel a sense of community. Okay, what do you guys think? Myth or fact? Hair pulling disorder, hair pulling can take place all over the body. So does it happen just in one place? Is it just on our heads? Is it everywhere? What do you guys think? Okay, great. Wow. Let's see. Share. Okay, so the vast majority of you guys think it's a fact. Some of you do think that it's a myth. So let's see. So the majority of you are right. It is a fact. Hair pulling can take place on any body part. So really, with trichotillomania, pulling can happen in any body region that there is hair. So the most common site, the vast majority of people report picking at their scalp, then the eyebrows, that's also reported by many people, and then also the pubic region. And you see these numbers don't add up to 100 because some people report picking at multiple sites also. So that's also interesting to note. What do you guys think? This is a big question. Hair pulling is a form of self-harm. Almost everybody responded. Let's see. Anybody else want to respond? It's a big question. Okay. Let's share the results. Very interesting. You guys are split very almost down the middle. 52% said it's a myth and 48% said it's a fact. So very controversial statement. So let's see. So it's actually a myth. So hair pulling is not a form of self-harm. So I mentioned this briefly, but the DSM-5 or the Diagnostic and Statistics Manual, which is the book that mental health professionals we use to diagnose different mental health disorders. So it specifically states a hair pulling disorder is not diagnosed if the behavior is better explained by something else, such as self-injury. So that's important to separate. And then we also, in terms of intent behind the behavior. So we have two different types of pulling. We like to differentiate them as first automatic pulling. So that's something that happens outside of your awareness. So a classic example is you'll be watching TV or you'll be working and then all of a sudden you'll be mindlessly picking your hair and you don't even realize that you're pulling, sorry, pulling your hair. And then so there's no intent of harming yourself because it happens outside of your awareness. And then in focused hair pulling, that often people, a lot of our clients report feeling like they're in a trance almost, that they all of a sudden they get this urge to pull, and then they start pulling the hair and they can't get out of it. But typically that's there to fulfill some intense urge or to regulate emotions like stress or anxiety, boredom. That's another big one. So again, the intent here isn't to harm yourself. And then I just want to say about pain. So really, pain isn't the cause or the goal or the drive of pulling, but it is the motivation for self-harm. So these are really the two reasons why, the main reasons why we differentiate between hair pulling and self-harm. But it is a very controversial myth. Okay, what do you guys think? Hair pulling disorder is more common among females. More people want to answer? Okay, let's show. So the majority of you guys, 82% think it's a fact, but 18% of you think it's a myth. So let's see. It is actually a fact. Um, but I am rating 2 stars. So first of all, hair pulling disorder is more common in females than males. So in a recent study, they found that in adults, trichotillomania or hair pulling disorder appears to have more females report it than males. So 4 to 1, actually. It's a lot higher. And then interestingly enough, they found in the same study that in childhood, the gender distribution is actually found to be equal. Why did I put a star there? Because there are conflicting reports and studies, and some research has found that there is no difference between genders in terms of the prevalence of trichotillomania. The the general consensus right now is that we do say that there is a higher preponderance among females, but there have been different um, studies that found, or surveys and studies that found otherwise. So I just want to provide you guys with the information, and then you can see what you think. So let's talk a little bit about gender differences. So in a recent large scale study in actually the US general population, they found that the mean or the average age of onset was different for men versus women. So men, the average, it was later, it was around 19 years old, whereas women, females, it was earlier, of 14, almost 15 years old. And this difference was statistically significant. And then they also found that a significantly greater percentage of females compared to males, they endorsed having more severe distress from hair pulling. And they also said that they had a major impact on their lives from the hair pulling. So they, in terms of a rating scale, they rated it higher than men. And then interestingly, I just didn't put this on the side, but I also thought this is interesting in the study that they found that men and women with trichotillomania didn't differ in terms of rates of specific co-occurring disorders or comorbid disorders like depression, anxiety, OCD, like other things like that. So there wasn't a difference. So I thought that was interesting that it was the same for men and women. Okay, what do you guys think? Myth or fact? Um, Hair pulling can affect people of all ages. What do you guys think? Watch. Okay. And then the poll, share the results. Okay, so the massive majority of you guys thought it is a fact. But some of you thought it's a myth. I feel like I kind of gave this away right before, though, that I said we talked a little bit about childhood and myths. But good. We're all learning. um, so it is a fact. Hair pulling does affect both children and adults. So um, I talked about a recent large scale survey of trichotillomania in the general US population, and they found that on average, they're not talking about gender differences, the average age of onset or the time of uh, hair pulling that it started was 17.7 years old, so in late adolescence. So for participants of the study, they that had reported having trichotillomania in the past, but they didn't have any current symptoms. It was interesting. They found that the age of onset for them was actually slightly younger than those with current trichotillomania. So it was 15 years old compared to the 17.7. So they said, first of all, that difference wasn't statistically significant, but I read this and I was like, that's kind of interesting. And then also, I thought maybe this would interest you guys is that for those participants that reported having past symptoms but not current, they said that their hair pulling stopped on average after 10 years. So I thought that was also interesting. I don't know if there they had therapeutic interventions, if they had treatments, they stopped spontaneously. But I thought that was interesting that it took 10 years for them to not have symptoms. Okay, myth or fact? We're nearing the end of these. Hope you like the polls as much as I do. So myth or fact? Hair pulling only affects those with poor hygiene. What do you guys see? Okay, I'm gonna end the poll. Anybody else? Oh, trickling in. Okay, let's share. Amazing. 100% of you guys all think it's a myth. Love it. So yes, you guys are all right. Hair pulling is not a sign of poor hygiene. We said already that it is a recognized mental health disorder. And really, why did I think this was I was surprised when I saw this, that this is something that comes up a lot among clients or among our community, that this really is, people think that it's a sign of poor hygiene. So this really speaks to the stigma surrounding the disorder. So just emphasizing people don't engage in pulling behavior due to a lack of cleanliness or motivation to care for themselves. Um, really, studies show that people with hair pulling disorder often they experience higher anxiety and stress and difficulties with emotion regulation, and that's typically what drives the pulling behavior. And we like to think of this as a vicious cycle. So typically, people feel difficult emotions, and then they try to deal with these difficult emotions, not in a healthy way, but by pulling hair. And then, unfortunately, the pulling, like we said, it leads to impairment. So it actually leads to more difficult emotions, and then it's a cycle that happens again and again and again. And that's where we like to cut it with therapy. Okay, here's another big question. What do you guys think? Myth or fact? If you have trichotillomania or hair pulling disorder, do you have OCD? Or it means you have OCD. Myth or fact? Okay, anybody else want to answer? All right, I like this one. Okay, we're a little bit more split. You're not all in agreement on this one. So 72% think it's a myth, but 28% do think it's a fact. So let's check this out. It is definitely more controversial. So it's a myth, actually. So hair pulling disorder is not OCD. So why is this a myth? Or why is this so controversial? So remember I talked about the DSM-5, the Diagnostic and Statistic Manual, the book that we use to diagnose mental health disorders. So we classify trichotillomania or hair pulling disorder under the family of disorders called obsessive and compulsive and related disorders. So this family of disorders includes trichotillomania or hair pulling disorder, but also hoarding disorder, skin picking disorder, body dysmorphic disorder. And what are the similarities here? Is that there is a similarity of a repetitive behavior, right? So here we're talking about hair pulling, OCD is other repetitive behaviors. But let's talk about the difference. So again, remember we talked about this with self-harm. So there is a difference in the underlying reason of the behavior. So in OCD, what happens, it's very complicated, but I'm just gonna like simplify it into a few sentences. In OCD, what happens is the person has an unwanted thought, image, or urge, which is the obsession. So there's a trigger that leads to obsessive thoughts. And this leads to a feeling of distress. And then the person does a repetitive behavior or a compulsion which the goal of that is to relieve the distress. And then there's two important things here is that in OCD, there's an element of magical thinking typically. And what does this mean? So we'll demonstrate this with an example is that I could have an unwanted image or an obsessional thought of, for example, a loved one or family member getting into an accident. And then I feel distress from that. And then I go and do the classic OCD example of hand washing, compulsive behavior, and I wash my hands in a compulsive way with the goal of reducing my distress because of the obsessional thought. And the magical thinking here is that if in OCD, the thought is that if I wash my hands, the bad event in the outside world won't take place. So the bad event of the accident won't take place. So we say it's magical thinking that my actions have some influence on the world in the greater scheme of things. And then also a big thing with OCD is that the compulsive behaviors, they're unwanted. We call this ego dystonic. And so they are unwanted. I don't want to be washing my hands all the time. And then also in hair pulling disorder, it's often hard for us to get clients to release the hair pulling because sometimes it's not unwanted. Sometimes it is something that they feel an element of satisfaction after doing. And then I also do want to talk about a little bit of differences between treatment for hair pulling versus OCD. So in OCD, we treat it specifically with ERP or exposure and response prevention. It's a very complex and long process. And typically what you do is you directly expose the person to their obsessional triggers. So for example, with the unwanted image of the car accident, I could sit with a client and we could write out a whole imaginal script of the family member getting into a car accident, raise the feeling of distress, and then make sure that the person doesn't engage in compulsion. So they don't do the hand washing while they feel the distress. And we typically do this in a hierarchy, and it takes a long time and in many different areas. And hair pulling, it's more of a simpler, shorter treatment. The crux of it, I'm not going to get into the details also, but the crux of it is finding alternative behaviors to replace the pulling. And then also just a word on medication. Trichotillomania doesn't respond to the same medication as OCD. So again, if they were the exact same disorder, they would respond to the exact same medication. So these are all kind of reasons and evidence why they're not the same. Okay, our last two. So myth or fact. Trichotillomania is a sign of mental weakness or instability. Okay, wonderful. Okay, you guys are also majority, but also split. So 80% think it's a myth, 20% do think it's a fact. So that's interesting. So let's see. So it's actually a myth. The majority of you are right. So trichotillomania, like we said, is a recognized mental health condition. So it's been shown to arise from really a complex interplay of factors, of genetics, of environment, of psychological factors. So first of all, twin studies show us in research that there is an element of a heritable link for trichotillomania. Environment. So things like exposure to bullying, domestic violence, traumatic life events, infections, birth complications. Those are all things that in our environment that can impact and lead to trichotillomania. And then for psychological factors, things like stress, anxiety, perfectionism, difficulty with emotion regulation. These are all psychological factors that can contribute and lead to trichotillomania. So definitely not uh, a sign of mental instability. It's it's a diagnosed mental condition and it comes from a wide range of factors. Okay, guys, we got to our last myth or fact. Um, what do you guys think? Myth or fact? Hair pulling disorder is treatable. Anybody else? Wow, almost all of you participated. Okay, so let's share the results. So 82% thought that it's a fact and 18% think it's a myth. So we're not all in agreement here. Um, but I do want to say that it is a fact. So first of all, seeking professional help can definitely greatly improve outcomes. So I do also want to say this, maybe this is what people were talking about when they said they think it's a myth. It does require a great deal of hard work. It does require time. And some people have relapses throughout their lives, and it might not be something that's going to be gone away forever, but it is something that can help you manage your symptoms. That is for sure. That's what therapy can help with. I do want to say though that it is unfortunate that a lot of people don't seek help, and it is actually uncommon for people with trichotillomania to seek help. So I found a recent study that they surveyed over 1,000 people, and only 39.5% sought treatment from a therapist. Only 27.3 sought treatment from a psychiatrist. And so they said that one of the reasons for their low rate of seeking treatment it was that the vast majority, 87%, felt that the providers know very little about the disorder. So that is something that we hear a lot at TrickStop, is that a lot of our clients have struggled to find professionals with expertise in this area. It is a very niche topic. And so it is very hard to find people that have expertise, the knowledge and expertise and experience treating this disorder. And then again, we talked a little bit about this before, but other reasons for not seeking treatment include feelings of shame, embarrassment, lack of awareness, fear maybe of the professional's reactions, fear of what might happen. So this is a lot of kind of the reasons why people don't seek help. And I do want to share a little bit about TrickStop, which is kind of an answer to this. So TrickStop is an online, fully customized therapy platform. And here, what we do is we set you up with an expert therapist that has the experience and the expertise, the knowledge, past experience And they guide you through every step of the way of this online therapy platform. And I'll just talk a little bit about the two main types of therapy that we use that it's all based on is HRT or habit reversal training. That's considered the gold standard of treatment for hair pulling disorder. And here you basically work on awareness training, competing responses, stimulus control. If you want to learn more about this, we have a dedicated webinar on this on our website or on our YouTube channel. And basically, like I said, like through this treatment, you learn to find healthier replacement behaviors to deal with your difficult emotions. And then in ACT or in acceptance and commitment therapy, that's where you learn how to deal with the difficult emotions and urges that typically lead you to pulling. So first you work on more of the behavioral part. What can I do instead? And then you also start to work on how do I deal with this? What are these difficult emotions? And you work with your therapist together. Okay, so we're done all of our polls, but why are there so many myths? There's so many myths out there about hair pulling disorder. So first of all, hair pulling disorder, it's not as widely recognized or understood as maybe other mental health conditions. So maybe that's why there's a lot of misinformation and myths about it. Stigma. We also talked about stigma. There is still stigma surrounding mental health disorders in general. And then specifically also about the shame of hair pulling, the behavior. And so people tend not to be so quick to open up about their struggles with hair pulling. And then that can lead to misconceptions about the disorder. We talked about the different complexities underlying the condition with different contributing factors like genetics, the environment, psychological factors. And maybe the fact that it's so complex leads to a bunch of different myths. And then also some people may misinterpret their symptoms of hair pulling disorder. Like we talked about this before, like maybe just as a bad habit or maybe a lack of self-control rather than a diagnosable mental health condition. And then I thought about this also as important. I think the media often portrays people with mental health conditions in a very skewed way, leading to a misunderstanding about people with mental health conditions in general. And it doesn't really accurately reflect the day-to-day lives or experiences of people with the disorder. So I think that's also contributing to misinformation and myths. And I just wanted to talk about a few tips that you guys can use yourselves when you're maybe online and you're reading things and about hair pulling disorder and how you can kind of see maybe this is a myth, maybe this is a misconception, how you can debunk it yourself. So first of all, you can verify the claims that people are making by checking different resources that are reputable. So things like medical journals, academic institutions like universities, governmental health organizations like the World Health Organization or WHO. Those are really important to like look, check what this person is saying. Is this real? Is this true? Look at the author, look at who's writing this. Are they credible? Do they have expertise in mental health? We want them to be qualified. We want them to be a professional or a researcher with relevant experience, like not just some, I don't know, random person. Also, this is a big one, is to be aware of the sensationalist or alarmist language. So often people that are spewing misinformation, they use dramatic or exaggerated claims, and that's really to grab people's attention. So definitely, if you see that, maybe then start to go into the references, look at other places, check who the author is. And then also look for citations and evidence because legitimate articles and provide references to the studies or the expert opinions. And if there's a lack of this, it could mean that it's just unsubstantiated. And then I always like to say, if you're in doubt, really just seek advice from a licensed mental health professional. We're here because we are trained in this. We work in this. This is our day to day. And so we're here to provide guidance. And if you ask me a question and I don't know the answer, then I know who I can go and consult with and then provide the answer again. So I think that's always a good guideline. And then finally, personal stories, they can be very, very insightful. So like I said before, we actually have support groups here. But somebody's personal story shouldn't be taken as a universal truth. It might not be true for every single person. So it really is important to verify if you have a personal story or a personal anecdote, verify it with scientific research. Make sure that there are expert people, scientific studies that verify and back this up. So these are all kind of some tips that I think you can use to be a more critical consumer online and kind of see if you think that things that you're reading they're myths themselves. I don't know. We live in the age of AI and ChatGPT. I don't know. So it's important to not take everything that you read as fact and to think critically about it when you're reading. So I just want to do a quick conclusion, then we'll get into some Q&A. So we talked today about 10 of the common myths and facts, and we debunked some of these so that we said trichotillomania or hair pulling disorder, it's not a bad habit or a phase that people just grow out of. It's not a rare condition. It's actually pretty common. It's not the same. Hair pulling is not the same thing as self-harm. We showed the difference between the intent, the pain. It's not a result of poor hygiene. It's a recognized mental health condition. It's not the same as OCD. It's related. It's in the same family of disorders. You can think of them like cousins, but it's not the same. And trichotillomania is not a result of mental weakness or instability. It's a result of a complex interplay of a bunch of different factors, like we said. And here we go. Why do we think there's so many myths? We talked about there's a huge lack of awareness of it, leading to misconceptions, stigma surrounding mental health conditions in general, but also the shame of hair pulling, the behavior itself. Like I said, the complex nature of all the different factors that interplay. And then people who misinterpret their symptoms and think that it's not a mental health disorder. And then the media, I think, always kind of spews and skews. And then I gave some tips that you can debunk mental health myths online. So again, to verify your authors and the sources, look for citations, assess the tone and the language, look for alarmist, exaggerated claims, question personal anecdotes, see if it's a universal truth or not. And when in doubt, always consult a professional. So I just want to remind everybody about TrichStop. So like I said, it is an evidence-based online therapy platform that really does work. You're paired with an expert therapist that gives you professional guidance with hands-on experience and knowledge in hair pulling disorder. And you're working from the comfort of your own home. So, and it's also a fraction of the cost of face-to-face therapy. So if you have any questions about that, definitely email Tricks or message, type into the chat now or email support@trichstop.com. And here I wrote for you guys $100 discount for the first month of subscribing to our program if you use the promo code PROWEB100. So let's jump into some questions. Okay, so the first question. Hi, I have a question about comorbidity. I've heard the hair pulling can be a symptom of ADHD in terms of struggling to control emotions, impulses, and being overly fidgety. Have you heard of this connection before or come across it when working with people with trichotillomania? Yes, great question. We have a webinar all on ADHD and BFRBs or hair pulling disorder and skin picking and cheek biting. And there is definitely a lot of comorbidity. And I would suggest going onto our website, trichstop.com, or onto our YouTube channel, look in Trichstop, and look up ADHD comorbidity. There definitely is a lot of research on that. So great question. Yes. Oh, I don't know if I said this at the beginning. The webinar will be recorded. and will be sent out to anybody who signed up for it. So definitely don't worry if you missed part of the beginning or the end. Or the next question is this program covered by FSA or HSA insurance? So I would, my blanket answer is no, because it actually is a text-based therapy. So you are writing to your therapist and they respond to you typically within 24 hours. Um, but ask your insurance provider. They might, but the blanket answer is no. Well, issue after 2 months, I suddenly feel different about myself. I think I look different. Is this because my mental image of crippling? Mind you, I pulled 4 lashes before I started describing myself as a way to distract myself. I'm trying to understand the question here. Is it that I think I look different because of my mental image of hair pulling? I'm not quite sure. I understand the question. If you want to write in the specific question, I'd be happy to answer. Good question. Is there any relationship between age of onset and severity? A group of tricks started at age 12 and my son has started playing at 6, which seems startlingly early to me. Good question about age of onset and severity. I don't know about any relationships about that. I could definitely look into that. 6 is early on average, but it's definitely been documented that it's earlier. There are infants that actually are reported being pulling hair. So I do want to say, if you're talking about your child that has struggles with trichotillomania, we have a parent program so that you as a parent can sign up and then work with your child who is young, who's 6 years old, and work with them in treating their pulling. So if you want to hear more about that, definitely email at trickstop.com, the support of the tricks. You're welcome. What are some good alternatives, like fidget spinners, fidget rings, etc., that you found actually work for trick sufferers? So there's a lot of different, we call these competing responses. It's so different per person. So some people use things that they just pull on their clothes. Some people like to do things just on their body. They clasp their hands. Wherever they're sitting or standing, then they touch whatever they're sitting or sitting. Fidget spinners are a great one. Painting nails. There's a list you can look up. I think it's the giant list of BFRB competing responses. I think that's what it's called. There's an article that one of our therapists wrote. You can look it up online. Laura Sandner, if you want to look that up. But if you join our program, we actually we work with this all the time, and that you can work with a therapist to specifically try things. We have online tools that help you track what you've tried and what works in different situations. So, good question. Next question. I really want to avail of this therapy and actually subscribe at one point, just can't afford the cost, even though the fee is justified. I'm almost bald and it's affecting me deeply. Okay, so we do actually have discounted programs. I'm just looking up here. What the pricing is. So our general package is $260 every 4 weeks. That's our main package. We have discounts and we have upgrades. So our discounts, you can get weekly access to the therapist instead of daily or as much as you want. So that's at $120. Email the support at trickstop.com. See if they think that this is a good package for you. If you can afford $120 every 4 weeks, it's definitely a lot cheaper. And it's definitely a good resource. Okay. Ooh, that's all. And so I read a study about memantine and trick. Can you speak to any of the medication treatments? I have trichotillomania and I'm also a psychiatric nurse practitioner, and I would like to be able to help myself and others with medication-wise if possible. Okay, I also read about this study, I believe. They definitely did. Our clinical lead, I believe, sent this out to all of us. Um, I need to remember what the like takeaways of it were. It is, first of all, if anything, it's very, very new in research. So I don't know. As of now, the blanket statement is there is no FDA approved specific medication for trichotillomania. Also, some of our clients have tried NAC medications, NAC, while using our program and found it useful. But again, there is little research on it. So my statement is there is currently no medication specifically for it. Also, in terms of somebody asked about prescription or supplemental health, also there is nothing scientifically proven right now to be helping. This I've tried most things to try to get better. What do you think it takes for me to stop pulling completely? Because I feel like I can't stop. Well, I'm in fear of pulling. Okay, well, it sounds like you're really, really struggling, and I really would suggest trying to get some therapeutic help. So I think if you're interested in it, you can definitely email support at trickstop.com. See if this program could help. See it, try it out for a month. You get a discount and see how you feel. Hopefully, it can help you. Also, for suffering from a young age, it definitely is. Trickstop is a proven program that works. So I definitely would suggest trying to sign up and trying to get some professional help. Great question. Do you use of stimulants for ADHD treatment with co-occurring trick? Do they worsen hair pulling behaviors or help? What are you seeing in practice? I actually don't know specifically about this. I don't think I've worked with anybody with co-occurring ADHD with while taking stimulants and trick. Um, I wonder, I bet it's in that webinar. I didn't give that webinar on ADHD. But like I said, we have a webinar on our website specifically about ADHD and trick, so I would look that up. What is your opinion on NACs along with therapy? I said this before. So like I said, some of our clients have found it helpful while in therapy, but there is little research on it. So I don't yet want to endorse it. I'm big on research, evidence-based. From Georgia, webinar was interesting. Thank you. Level of awareness in this direction is very low, and I feel a little late. It is very low awareness. So I highly suggest joining our communities, joining our website. Even look on trickstop.com. There's free resources if you're not ready to sign up for our therapy. And definitely social media. Definitely follow us. Started at 8, now 59, worse than ever. Didn't pull during pregnancies. Thoughts? Sounds like you're experiencing a increase in symptoms right now, and maybe now is a good time to start treating it. Maybe it does increase with age for you. A lot of people find that it's ups and downs, so definitely working with that therapy. Has anyone ever been cured? I've had this from 14 and now 66. So again, like I said, cured. We're here to manage symptoms, and a big part of this is relapse prevention. So we know that relapses happen. People go back to behaviors. But yeah, we definitely significantly reduce symptoms and actually very quickly too. So I would suggest definitely signing up for therapy. It's not trick stop any therapy, but it definitely helps. So somebody says, how can I use HRT? You work with a therapist. you want to learn more about HRT, it's we have a webinar specifically on it. So I would definitely look that up on our website. Is trichotillomania hereditary? So yes, there is definitely a hereditary component. It's not 100%. It's not one-to-one. If the mom or the dad has it, then the kid has it. But there is definitely a genetic and hereditary component. It's statistically significant, of course, only one study. I don't remember which one, but the things that I presented here are things that have been presented in multiple studies also. So maybe I just cited one study, but I could cite more if you would like. Okay, not sure again which one. Um, seems to be hormonally linked from my experience. Hormonal changes. Interesting. That definitely could be involved. That's actually really interesting to look up if it has to do with specifically in women, if menstrual cycles or pre-post menopause. It's actually a really interesting area to look into. I'll look into that. I'm not sure. Okay. So thank you guys all for your amazing questions and for attending. And if you have any more questions, you can email us at support@trickstomp.com. Thanks so much. Have a great day.